All right, so in this Q&A this week, I'm sorry I had to change the timing last minute, but something came up and I figured anybody who wants to watch this specific Q&A can just watch it later, and any sort of questions that you have, I'll get back to them the next day. I wanted to do this one on back problems because I got some messages from you guys and actually from some other people as well. They were struggling with low back pain and not really knowing how to handle it. So I figured I'd shed some light on that with this week's Q&A. Now, some of you might know this and some of you might not know. I'll give you a quick intro of how I had very big back problems myself, and actually it was part of why I got into this profession. So when I was about 14, 15 years old, I think, I started to have pretty severe low back issues. Nothing happened, no injuries or anything, but I was playing a lot of sports at the time. And the problem was, looking back, I had a job where I had to stand all day, really all day, and the pain in my lower back got pretty severe. So I did what most people would do, or actually what my mom and my dad did. They took me to a doctor, and the doctor sent me into a physiotherapist. The physio at the time said that my lower back was too curved, so lordosis is what they call that. And they said it was pretty much impossible to change because it was genetic. Okay, so then they took me to a manual therapist, and they said, oh, actually there's a couple of parts of the spine that are out of alignment and we need to manipulate them, adjust them, and put them back in place. I had a couple of treatments, and they cracked and popped my back. And it gave me a little bit of relief, but not really. Then they referred me to a chiropractor that said that my pelvis was actually out of alignment and it has to be adjusted because it had an effect on my knees and hips and everything. And he actually said that I had to come in twice a week for the rest of my life, because otherwise the joints, so this is spine, and I'll use this model a little bit for this explanation. The joints between the different parts of the spine, as you can see over here, for example, would start to wear down, and I would get early onset arthrosis, arthritis, and that kind of stuff. So he kind of scared me, actually. He treated me a couple of times, didn't really change. And he said I probably needed insoles because the problem spread, and now my feet were flat and I need to get insoles. So I got insoles, and that didn't really help either. And after a while, I just gave up. I just felt like this is what I have to live with. There's one thing I'm forgetting. The first therapist, the person that said that I had a genetic problem, also mentioned that I would be, genetically weak. My back would just be genetically weak because of that. So I gave up for a while, but I got really frustrated because I couldn't play any sports and stuff either, and I really liked doing that, so I went down and down and down. After a certain point, I said, I don't want to do this anymore. I just want to get back to a normal life. And that's why I started to pick up Thai boxing. And my first session I told the coach, like, oh, you have to know these things about my back. I have a genetically weak lower back, and my feet are flat, and therefore I can't do a lot of things. And he pretty much cut me off and said, that's ridiculous. There's no such thing as anything genetically weak like your lower back. You are just weak because you're weak, not because your back is weak. You're not born weak, you get weak. So I was very offended initially. And then he showed me a couple of things like a plank and laying down and pushing himself off the floor, and even with one hand, and all of the things that he showed me, and afterwards asked, can you show me to do that too? And keep in mind, this guy was like 60 years old. I couldn't do it. All of the things that he showed me, I couldn't do it. And I was just so shocked. I was like, how is this possible? How come he can do this? He's 60 years old and I can't. And then he said, that's because you're weak. and if you work on those weak points, you won't have any issues anymore. So he made me a deal. He said, get rid of the insoles and start training with me, and we'll get you strong again. And we did that, and within maybe 2 or 3 months, I was able to pretty much do everything without pain, lift my own body weight, squat, press, I could Thai box, anything. So made me realize that all of the healthcare practitioners that I've seen were all wrong. They clearly didn't understand the issue, and my problem was that I relied on them to give me a solution, even though clearly the solution was in myself and I could overcome it myself as well. The reason I'm explaining that is I've seen thousands of back problems over the years. Some of them very severe, some of them not so much, but they all feel very severe. Back pain is really, really painful. If you ever had this before, and 80% or something of the population gets to deal with back pain, sometimes you can't get out of bed, you can't tie your shoelaces, you know, you can barely turn over, you can't lift your kids, you can't do the activities that you want to do. It's really debilitating. So it makes sense that it comes with a lot of frustration. People don't know what to do. People go to a specialist, pretty much believe everything a specialist says, even if that means surgery. So typically, and I've seen this many times, somebody goes to a doctor, doctor sends them in to get a scan done. You get a scan done, and then the orthopedic specialist says, ooh, we see that the disc, this is the disc by the way, it's like a little sponge shock absorber between the two moving pieces of bone. Ooh, the disc is all squished. It's really a deterioration, a sign of early onset deterioration. Oh, the disc is bulging out of place. Oh no, that's terrible. Oh, it seems like there's some early degeneration of the joints over here. Or maybe even some small bony growths are starting to form. Oh no, that means we need to do something. We need to go in and we need to shave the bone, and we need to take out that bulge. And even when people have like herniations, which is where the bulge kind of presses against the nerve. This is the spinal cord and the main nerves in the back. So if you hear that as a client, of course you're going to be like, oh no, this is very serious. We need to take care of this. And you undergo surgery. The problem is we found that all of these things that show up on the scan are extremely common in people that have no symptoms at all. So I can link to the actual percentages because I'm going to get the numbers wrong, but having disc bulges, so having that disc kind of pop out at the back slightly, I think the prevalence of that in 50 years and older is about 40 or 50% or something. So that means that of everybody walking around, especially with people without any issues, 50% of them, the 1 in 2, has these sort of things showing up on the scan, and they would never ever know. Disc degeneration, so flattening of the disc, or degeneration of the smaller joints on the side, even more common, 60%, 70% even. So almost everybody. What does this mean? This means that the things that turn up on a scan typically are the same things that show up on a photo. If I'm taking a photo, you can start to see, oh, maybe you start to have some wrinkles here and there. Maybe my face is looking a little bit puffy today. It doesn't necessarily represent how I feel, right? So normal signs of aging, of use, show up on your spine just as much as they show up on your face. But that doesn't mean that you have to be in pain all the time. Okay, so what's the takeaway of this? Takeaway of this is that 80% of all the low back problems that I see, severe or not severe, are completely reversible without the need of any medication or any surgery or any other procedure. Okay, and I will walk you through what I typically do with a client if they come in and they are in that state of, you know, having a lot of issues, having a lot of frustration, etc. The first thing I do is I try to find evidence that supports the idea that there's no damage, right? So, was there any trauma? Did you get hit by a car, for example? Did you get taken down, kicked in the spine, or any of those things? No, is that not the case? There's no force that came in to the spine. Then it's pretty unlikely that there is suddenly any damage. Not impossible, but unlikely. What about the pain? Is it local? Can you point it out with one finger? And these are all examples, by the way. I can't give you the entire process, but it should be enough to give you an idea. Is the pain located on one point? Can you point it out with one finger and that's where the pain is? Or does it strongly radiate? And does it maybe radiate to the legs or to other limbs, right? If the pain is localized and maybe pressable, that's a good sign. If it's referring to the legs or limbs or arms, typically a little bit less sign. So now we know that this person, just an example, no trauma, just nothing really happened, no impact or anything like that, and the pain is quite local. I can press it, oh, that's where it hurts. These are good things. Then, do you have any issues with your limbs? For example, with a herniated disc, when there's really an issue with the nerve being compressed, what happens is signals from the central nervous system to the legs or arms can be affected. And that can mean that, hey, my skin is starting to feel different, hypersensitive or numb. Or I have problems with controlling my muscles. Every now and then I take a step and I lose control, or I can't seem to lift up my foot very well. Or sometimes you can test certain reflexes and see if that communication is still there. That's a good sign to see if there's any sort of connection in the actual nerve structure, which that can be a little bit tricky to treat and puts you more into sort of the I wouldn't say worry about it case, but it could potentially be a bit more serious. If that's not the case, no control issues, no numbing sensation in the skin, then again, you're already one step closer to having a situation that is very influenceable. If it's not any of those structures, you didn't break a bone, you didn't herniate a disc that's so bad that you're compressing the nerve. You didn't get a nerve pinched between the bone. By the way, everybody says that they pinch a nerve. Structurally, it is virtually impossible to get a nerve pinched between two pieces of bone or whatever. If that would be the case, you would know. It is not. You don't have to go to a doctor to find out if you have a pinched nerve. I don't know if you ever hit your, they call it the funny bone, right? You hit it and you feel, that is a nerve. Touching a nerve will send signals like thunder and lightning through the arm. Having a root canal issue, for example, toothache, usually nerve related, you know, it's a very distinct sort of feeling. And usually what is known as nerve pain or as a pinched nerve is not a pinched nerve. It is, if you do have sensations going down to the arm or to a limb, which is normally people think that means they have a pinched nerve. That's not the case. It could just be what we call referred pain from a muscle. Every muscle has a certain area that they send pain to, potentially. So a good example is, you may have seen this treatment that I did to myself. There's a muscle, for example, the temporalis on the side of the head that can cause headaches across the temple area and in the top part of the skull. In those cases, it's not the head that has the problem, it's the muscle that has the problem. It sends signals to that area. So that doesn't mean there's a nerve issue, it's a muscle issue, and muscle issues can be very easily influenced. So the same thing goes here. That nerve goes all the way down to the leg. There's many places where you could have some irritation, a muscle pressing against the nerve, but in most cases it is not even that. So there's not actually a muscle that is pressing against the nerve root. It is the muscle itself that has an issue and then sends pain signals down to the arm or the limb or whatever it is. So it's important to know because it gives you a good idea of how serious something potentially could be. So let me backtrack a little bit. Somebody comes in, severe lower back issues or upper back issues, wants to know, could there potentially be damage? If there's no trauma, then I wouldn't consider there's a big chance of having damage. If the pain is local and you can just press the area and know, hi Camilo, how are you doing? You can press the area and say, this is where it hurts. Very low chance of having a lot of damage. If you have a local pain and it doesn't go to the arms and legs, etc., very low chance of having damage. So that means once you've reached that point, okay, you can start to look at then what could it be. And as I said before, about 80% of the low back or spine issues I see are muscular and usually have to do with either overload patterns, and I'll talk about that a little bit more, or behavior, which is could be posture, sitting too much, always sitting on the same side, slumping, slouching, all of those kind of things, or lifting heavy things at the same particular way all the time. So let me give you a quick example. If I have a heavy job, for example, and I do a lot of lifting, and I always lift with my back in the exact same position, then of course, hi Carol, good morning, then of course exactly the same area of the spine is going to be used, and then of course that can lead to overuse issues quite easily. So in those cases it has more to do with the behavior and always doing the same thing, right? A very simple example, if I keep doing this all the time, this area is going to be irritated. The only thing you have to do is just make sure you divide it a little bit better, okay? Then if it's not behavior, it could be an overload pattern, and that's actually very important because I want to always make the distinction between what we call a flexion pattern and an extension pattern, and I'll show you what that means. Flexion is basically bending over forwards, so curving the spine forwards, which if I do that with the neck would look like this. In the model, that would look like this. So that means on the front, the bones get closer together, the back gets kind of stretched open. So this puts some length, some strain on the ligaments and the muscles that are here, and some compression force on the front and on the bones and on the disc. If we do an extension, that's the other way, this would look like this. That is exactly the opposite. So the front gets some length or opening, and on the back we get some compression. So the bones over here get closer together. Sometimes if you have a disc issue on this side, you can have some more compression on the disc. And if there is any sort of nerve connection to this, which again is very rare, then that would be more likely to happen here as well. Now, it almost never happens that a client has, hi Ty, good morning, that it almost never happens that a client has both. So bending over forwards is super painful, flexion is super painful, and bending backwards or extending is also super painful. Almost never happens. So I either get people in that can barely bend over forwards, can barely sustain strain on the soft tissue, ligaments, muscles, etc., or compression on the front. Or you get people that can bend over forwards quite easily, but they can't, I can really not bend back, whether that's the lower back or the neck, which means they cannot sustain compression. So this tells me a lot. And what I do from there is I go through the diagnostic process in seeing, okay, let's say this person cannot bend backwards very well. Which of the areas could be the actual most irritated parts? And there's, of course, additional diagnostic process and testing that I can do, which is not really valuable or useful to share right now. But what is very important and useful for you is in most cases, if you have issues with one of the patterns, investing in the opposite pattern usually gives you a lot of relief, right? So I have a lot of issues bringing my neck back. The compression on those joints is very uncomfortable, or the tension that comes with that movement very uncomfortable. By investing in going the opposite way, which could be bending the neck or pulling the neck in, which we call retraction, but it's actually a bending of the higher part of the neck, can then take some of that force off of the back, or sorry, off of that particular area that's irritated. And in most cases, if you just do that for a certain period of time, a couple of days, and you invest in that a little bit, and you take out all the compression force, that typically just gets the job done and gets you over that point of irritation. And of course, the opposite is also true. So if it's the bending that just really annoys the muscles or the ligaments or whatever it is, then doing an exercise like a what do you call that? A cobra, for example, where you lay down and you push up and you go into that compression force. That then gives those areas a little bit of a chance to rest. Now, I'm simplifying this a little bit because there's more things that you can do. The back can, of course, rotate a certain amount. This is a low back, so the structure of the lower back is a little bit different. There's actually not that much ability to rotate as you might see. There is a little bit of ability to side bend, and they're all linked. So there's nothing completely one-dimensional. There's not complete forward bending or complete bending. There's always a little bit of gliding going on in the smaller joints there as well. So I'm oversimplifying the mechanics of this a little bit, but for the practical application, this is not important, right? So sum up until now, just take a look at the time, because we're going to have to round up, and I can do a little bit more about this to put it into practice. But trauma is damage is very rare. Most of the cases for the lower back that I see, even though they're very painful, amount of pain doesn't correlate with damage. Very, very poorly. There is just a lot of pain that comes with low back or spinal issues. That doesn't mean you have any damage. Damage can be assessed by a couple of questions, such as, was there any trauma? Is there radiating pain? Do you have loss of control of muscles? Do you have numbing sensation of the skin? And another one that I didn't mention, but is kind of important, is can you influence the pain? If there's damage or nerve compression or anything like that, typically it really doesn't matter what you do or how you move, the pain is always there, just like a toothache. But if it's muscular or joint, there's typically a position that you can find that makes it less painful, for example, which is a good sign. And if you rule out those potential damaging factors, then afterwards you can move on and see, okay, could it be that I have overloaded one of the two patterns? Do I have a flexion pattern, bending over forwards is painful, or maybe do I have an extension pattern where bending backwards is painful? From that point on, it's very simple. You want to invest in the opposite pattern. If you do that for a couple of days, then typically you can see, okay, the area that I've been overloading all the time is now getting some rest, and that gets you over that sort of episode of pain. Now, if that's not the case, there might be some behavioral issues or some technical faults. Like you might not notice that you're rounding your back all the time when you're doing a certain exercise. Of course, there can be other factors that play a part. There could be a muscle weakness, there could be an imbalance, and there could be a behavioral or technical issue, and it could very well be that the hips are an important factor for what the back is doing, just like the upper back influences the lower back, and so on and so forth. That's too complex to go into in this specific example. I just wanted to talk to you about patterns mostly, so that you can try and see if you can apply that if you ever have some pain. There are tests that you can do for this, of course. We've done the core stability test before. That gives you a pretty good idea if there is any issues in the forward part. There's also something like this for the side, which would be the side plank assessment, and you can do this for the back too, which would be a bridge, just like you know, and then you try to lift one leg and see if the backside, the posterior chain of your body can support your spinal column well. So actually, a full-on core test would have the plank test and a side plank test and the back plank test as well. So I just realized that might be a good thing to add to the program. Alongside with that, there's of course flexibility tests and control tests that you can do for the hips and for the upper back as well. But if you guys are interested in that, just let me know. Drop a comment below or in the box later when I upload this video, and then we can add those things to the test. I'll just drop them in the group so that you can practice them, and later I can just put them into the automation. I hope this makes sense, because I try to simplify it in a way that is easy to kind of interpret and not go too deep into the clinical aspects of it. So let me know if you have any questions below. I gotta run. If this time works for you, we can do the same time next week. If you prefer keeping it at 2 p.m., that's fine too. One more quick reminder, if you want to send in your program design for the Black Panther, do it today. It doesn't take that much time, unless if you're also video it. Ty send a full video in. It was really good, so no pressure for the rest, but there are some good programs that are being sent in. Camilla sent one in as well, and I have one or two more, I think. So go ahead and do that. If you have any other questions, let me know, and I wish you all a very good weekend. Bye. See you soon.